good evening. I'm Melisa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. Malaysia's HIV response has been shaped by decades of community advocacy, public health work, and dedicated people on the ground, including the good folks at the Malaysian AIDS Council. Now, to mark this year's World AIDS Day, we begin tonight's program with a short documentary reflecting on the progress we've made so far. And later, I'll speak with Malaysian AIDS Council Vice President Dr. Nur Afiqah Muhammad Salleh about where we are in Malaysia's HIV response journey and the work that still lies ahead.
In Malaysia, the HIV response has always been about people. The men, women, and families who face stigma, isolation, and fear. For 2 decades, global support gave them more than medicine. It gave them hope, a chance to be seen, and the strength to rebuild their lives.
Rather than having parallel programs that are funded internationally, we have been able to integrate and incorporate programs but are led and the services are provided by the NGOs, working hand in hand with clinics, at the state level and of course at the federal level.
With global fund support, NGOs reached the streets, the clinics opened their doors wider, and communities at the margins finally had access to prevention, treatment, and dignity.
They have used Global Fund financing to largely finance prevention, community outreach, and community services for the HIV response.
These voices, once hidden, are now at the heart of Malaysia's response, and the journey ahead is about making sure no one is left behind.
I applaud Malaysia for being a leader in this area.
The numbers matter, but behind every statistic is a story like Ridwan's, a reminder of why this fight is worth it. Ridwan knows the struggle firsthand. Once a patient himself, today he is a community health worker in Kuala Lumpur. His mission, to turn his journey into hope for others.
I work as a community healthcare worker under PT Foundation. It's a partner Malaysian AIDS Council and also Yayasan AIDS Malaysia. So we are doing outreach for the key affected population to do the testing on the ground and then to bring our client to the clinic for further testing or any prevention method that we can give to our client. When you got the treatment, undetectable viral load, you don't transmit it to other people. We have the opportunity to have a family. But along the way, Alhamdulillah, after a few years, already stable on treatment, he already get his partner, get married and get a son already. I think already have two children. Yes, that's what very memorable for me lah. So what make me stay in this, because maybe I can help people to give some hope and to assist their resilient journey lah.
But not everyone's journey is easy.
I have a few clients that because when they have this experience, they are away from their family because their family do not know about their status. Then because they have shame, they're not going back to their family. I have some clients that involve something like using substance. After we have supported them and then they have them to listen, they get their life changes, going better. And then some of them, even though some of them go get a new job and then have stopped on their substance use, and then some of them even though go to Umrah.
For Ridwan, these moments, patients starting families, others finding the courage to reconnect with theirs, are symbols of hope, proof that Malaysia's HIV response is working.
Communities are the backbone of public health responses for non-communicable diseases, communicable diseases, including HIV. because they can deliver prevention, harm reduction and testing in the case of HIV, the treatment literacy and adherence support. They are able to reach the key populations that often find it hard to access mainstream systems or in some places are excluded. It also requires a rights-based approach and designing inclusive and collaborative dialogues to ensure nobody is left behind.
And that's where prevention, including PrEP, changes what's possible.
PrEP is a medication that effectively to prevent HIV up to 99% for if you taken daily.
PrEP, or pre-exposure prophylaxis, is changing lives. In Malaysia, its rollout began with Global Fund support, national leadership, and the work of community programs like Ridwan's.
With access to the Global Fund, we were able to implement more differentiated services to cater for other key populations. So that's number one. And number two, we were also able to scale nationally, which was always a struggle when it was purely domestic funding.
So from the perspective of the Global Fund, I mean, Malaysia was obviously responding to their own epidemic in their own time and way before the Global Fund came in as a partner. What the Global Fund has seen Malaysia do is a consistent, evidence-driven response since their very first days. They had a CCM before we had CCMs. They had a coordinated response across sectors from the very beginning, signed up for the Sustainability Development Goals when that was the goals that the global community had put together, and they've really partnered with the Global Fund since then to both respond to the changes in the epidemic, but also respond to the way the world has responded to these epidemics.
We already fund almost everything ourselves. That means like 95% of that our funding. So the transition will be smooth and natural. HIV prevalence among people who inject drugs has declined from 22% in 2009 to 7.5% in 2022. This success stems largely from publicly funded harm reductions program. Since 2003, we've been working with 20 NGOs through the Malaysian AIDS Council, and we have been spent 8 million yearly with strong accountability. It ensures support which communities directly.
Ending HIV is not government's burden alone. Corporates are playing their part, making the transition sustainable. Yayasan Saim Darby is one of them. Their investments prove that HIV response is not just charity, but a shared responsibility.
Our support for MEF and MEC in the cause of HIV and AIDS, for prevention, treatment and care for HIV and AIDS is way past charity. It's not only charity, but it is our shared responsibility coming in together.
In Sarawak, commitment goes further. It's the first state to directly fund HIV programs. This tripartite effort, government, NGOs and corporates, shows how local leadership strengthens national progress.
Sarawak is showing a real leadership. We applaud the Sarawak state government's foresight and willingness to take ownership of this issue. Sarawak faces unique challenge that require even a greater level of interventions. From vast geographical barriers to the cultural and linguistic diversities of its people.
In Sarawak, we are very fortunate that everyone come together from the Malaysian AIDS Foundation, from Sarawak government, from Sangway Group and Tan Sri Jeffrey Chia, as well as Yayasan Saim Darby and Yayasan Petronas, as well as all the various NGO in the local area, and each playing their role, do their parts.
From Ridwan's patients rebuilding their lives to national leadership, corporate partners, and Sarawak's bold commitment, Malaysia's HIV response is no longer donor-driven. It is nationally owned, community-powered, and shared across society. Ending HIV by 2030 is possible. The story of Malaysia shows us how.
the video we just saw captures only some of the people and partnerships that are behind Malaysia's HIV response. Joining me now to help us understand the work that continues every day and also the challenges that lie ahead is Dr. Nur Afiqah Muhammad Salleh, the Vice President of the Malaysian AIDS Council. She's also a Senior Lecturer at the Department of Social and Preventive Medicine at Universiti Malaya's Faculty of Medicine. Dr. Ika, welcome back to the show. It's so good of you to join me. So that was such an interesting video, and in it, I think there was some mention of Malaysia's transition, or Malaysia's process of transitioning away from donor funding to sustain our HIV/AIDS response. I'm curious to understand why this transition is happening. Why is this shift taking place, and why is it important? What does it mean for the work that the MAC does, for instance?
Thank you, Melisa, for inviting us today. So the transition from international donor support like a global fund has been taking shape over the past several years. And we know that for more than a decade, the Global Fund has provided around 30 million ringgit in support. So that's roughly 3 to 4 million annually to strengthen prevention efforts among key populations. And what we're seeing over the years, our economy has strengthened and we've moved into upper middle income status. So we naturally began losing eligibility for certain forms of donor financing. And over the past 3 years, the government has been developing sustainability plans to kind of manage the transition from international support so that we can continue delivering HIV services. So it's a gradual process, and this shift was not sudden. But what has changed is really the speed of the transition. So right now, global public health funding is really stretched, and we know that big institutions like Global Fund, UNAIDS, and WHO, they're dealing with tighter budgets, they're dealing with shifting priorities, and also there's a lot of geopolitical uncertainty around that. And even the United States, which has always been the biggest contributor to global health, is also scaling back. And because of that, we're also seeing these other donor countries that are starting to do the same thing. And analysts would argue that we're entering this new phase for global HIV financing, one where the old model of large-scale multilateral funding needs to be rethought. And because all of these pressures, what we're seeing is faster and deeper funding cuts around the world, and donors are now focusing their support on, only the most undeserved countries. And what it means for us, for Malaysia and many middle-income countries, this would mean that we need to step up with more domestic resources far sooner than expected.
Okay. So what does that mean as domestic funding sources? Would that mean the private sector would have a role in supporting kind of the national response to HIV/AIDS?
Yes, that's right.
Okay.
It means that the Minister of Health, the domestic resources, the private companies as well.
Okay, so talk to me a little bit about that. How do you go about convincing or working with the private sector, with corporations, to support the Malaysian response to the epidemic? I'm just wondering, because I can only imagine this could be a great part of their CSR, but how do you go about convincing them, particularly when there are many other competing demands for the same resources?
Right. So I think the key is positioning. We know that with treatment widely available and AIDS-related deaths are declining, many would assume that the crisis has passed. But this perception, we often overlook a critical truth, which is nearly 1,000 Malaysians are still dying from AIDS-related illnesses each year. And what we're seeing over the news is also alarming, where we're seeing new infections among young people, and these continue to rise. So for corporate partners, MAC and also the Malaysian AIDS Foundation, we emphasize a very simple message that the epidemic is not over, and the gains that we've made are very fragile, and we need to have sustained investment to avoid reversal. So Malaysia's strength lies in our structured, science-driven national HIV strategy. And each national strategic plan is a long-term, is evidence-based, and it's anchored in public health logic. And these are qualities that appear to be appealing to corporations that kind of seek measurable and also credible impact. And this very clarity has been the key reason why Malaysian companies such as Yayasan Sime Darby, Petronas, and also Sunway Group, these companies have stepped forward as long-term, highly committed partners. And their involvement has created a uniquely Malaysian tri-sector ecosystem where, you know, we've got the government, we've got the civil society, and we've got the corporates. We're all collaborating in a very coordinated but non-duplicative way.
I love hearing that the kind of big GLCs have really stepped up and come and really helped in their response and filled that gap of funding as we're seeing international donors pull out of the ecosystem. Can I ask you, Dr. Ika, amidst this transition, are there any areas that you are concerned about that might face funding gaps? I'm just wondering, you mentioned the sustainability of the programs, so to ensure the sustainability of the programs, are there any risks to that sustainability that comes from this transition?
Okay, so to better understand where the vulnerabilities are, I think we need to step back a bit and look at how Malaysia funds its HIV response. Okay. For treatment, including the purchase of HIV medicines, the antiretroviral therapy, and other healthcare system costs, around 95% of the national HIV budget is already being funded domestically. So that's roughly around 80 million ringgit a year. And Malaysia has been providing free HIV treatment for more than a decade. So another key pillar is the social contracting mechanism, where the Minister of Health funds civil society organizations, including the Malaysian AIDS Council, to deliver targeted prevention services. And this model has matured over time. We start with MAC-led outreach, and then we integrate it with Klinik Kesihatan, our primary healthcare clinics, and now through the nationwide differentiated HIV services for key populations platform. Now, losing global fund support is definitely significant, but Malaysia isn't going into this transition unprepared. We've got sustainability plans that have been developed and tested, and the Ministry of Health has increased differentiated health services for key population funding from 7 million ringgit to 8 million ringgit for 2025, and to ensure that our frontline programs continue without disruption. But still, HIV is very sensitive for funding shocks, and gains that we've seen over the years can reverse quickly without a sustained investment and political commitment. So what it also means that the way forward lies in strengthening our domestic partnerships across federal, our state, and also private sectors. We want to diversify funding to kind of reduce vulnerability and keeping Malaysia's HIV response on a sustainable path.
Yeah, I mean, we saw some of those funding shocks with the pandemic when money was being diverted to other public health responses. So talk to me a little bit about the progress that we've made. So Malaysia should be so proud. We've made massive strides in reducing the prevalence of HIV/AIDS among key populations. But I saw a news report earlier this year that there had been a rise in the number of HIV infections amongst tertiary students. Can you talk a little bit more about that, Dr. Ika, and what strategies are in place to make sure that there is improved HIV prevention and care for this group in particular?
Right. So the main challenge that I feel we need to acknowledge is that there's this gap between the realities that young people face and the kind of information they actually receive. So Malaysian youths are encountering sexual content way earlier, right, through digital media, through their peers, through online platforms. But access to accurate, non-judgmental information is still very much limited by our norms and also institutional barriers. And we recognize this, yeah. So for this very reason, Malaysian AIDS Council has shifted towards a youth-led, autonomy-focused model, specifically through the KAMI model, which is a Kelab Kesihatan Anak Muda IPT, KAMI. So we empower university students to become peer educators, to become campus advocates, to deliver accurate information, and then to link their peers to services such as testing, treatment, PrEP, and mental health support. So I think for me, these peer-led models are really encouraging because young people would trust and relate to their own networks. And the goal is not only to educate, but we want to build trust, we want to reduce fear, we want to create a safe space where conversations about sexual health can actually take place. And these are all critical factors for sustained behavior change.
Right. Talk to me about incorporating some of those values into scaling PrEP, and making it more accessible. And well, maybe you can tell us a little bit more about PrEP. We heard about it in the video, but you can tell us more about efforts on that front, especially for areas that are, I guess, geographically diverse. There's more cultural barriers in place.
So PrEP is pre-exposure prophylaxis. So a lot of people would need PrEP because they are engaged in high-risk sexual behavior. So it's a very effective tool to prevent people from getting HIV in the first place. So we've got the PrEP Gov initiative. So that's a collaboration between MOH, Malaysian AIDS Council, Malaysian AIDS Foundation, and the Global Fund. And the uptake has expanded rapidly with around 10,000 Malaysians now using PrEP. And we've also got private clinics that are responding to rising demand, helping people to expand access. And we are currently pursuing a dual channel strategy. One is through Klinik Kesihatan, so that's the primary healthcare clinic. We want to reach out to low income and high need individuals. And second, through private GPs, private clinics, which can scale faster because of the flexibility and also proximity. But again, you know, with PrEP, there's always misconceptions. Some would critique that it's equivalent to promiscuity, but evidence is showing the opposite. PrEP users engage more frequently with healthcare providers. That's what we want, right? We want people to engage more with healthcare providers. We want them to be able to receive regular counseling, and most importantly, we want them to adopt safer behaviors. So MAC continues to emphasize on these data-driven realities to both communities and also stakeholders.
Right. So having said that, Dr. Ika, what do you still see as the challenges that Malaysia faces, or the biggest gaps that Malaysia still faces in wanting to achieve our goal of ending the HIV/AIDS epidemic by 2030? That's not long to go. It's 5 more years.
So yeah, we've got the tools, right? We've got PrEP, we've got HIV medication, but I think a lot of the remaining barriers would be more social, structural, and political. And you're right, we're moving towards to 2030, so that's our end game, right? We want to eliminate HIV by then. But what we urgently need to address is this persistent stigma and misinformation, especially around sexuality and key populations. Addressing rising infections among youth and university students that are driven by information gaps. So we need to fill in those gaps. Structural barriers, enforcement, environments that kind of deter people from seeking services. Sustainable financing as donor support diminishes, and domestic investment, state government support becomes central. I believe that we can still achieve the 2030 target, but only through sustained political will, diversified financing, and social environments that allow people to seek care without fear. And the progress to date shows what is possible, and the gaps that remain. It's a critical reminder for us to show us that the mission is far from complete.
Right. Just before I let you go, Dr. Ika, I had been following or reading up on the new breakthrough prophylactic, the new breakthrough PrEP. I'm not going to pronounce it because I'm scared I might get it wrong. Is it lenacapavir? Is that right? So okay, so that's been hailed as a breakthrough in reducing HIV, the risk of exposure to HIV. Talk to me a little bit about that. Is that going to be a game changer in the way governments respond to HIV and AIDS?
Yeah, so you're right. It's a game changer. It represents a transformative leap where it's a twice yearly injectable that dramatically reduces HIV risk, meaning that people would only need to use it 2 times a year. So every 6 months, a quick injection, that's it. But in Malaysia, we're pretty much limited for just one reason, which is the cost. So at this moment, we don't have lenacapavir in the country, and because of the cost itself. So current pricing places lenacapavir far beyond the reach of national programs and most individuals. So until affordability improves, its rollout will remain minimal. But that said, it still holds long-term promise. It signals the direction of HIV innovation and underscores the importance of planning for sustainable access. For Malaysia, this means closely monitoring global developments, exploring pricing solutions, and also preparing the health system itself, so that once affordability improves, the country can quickly adopt and scale this potentially life-changing intervention.
That is good news. That's so heartening to end on that note. Dr. Ika, thank you so much for being on the show today. That was Dr. Nur Afiqah Muhammad Salleh wrapping up this episode of Consider This. I'm Melisa Idris signing off for the evening. Thank you so much for watching and good night.